Good morning, Dr. Pete here. First of all, when trying to fast, work with your doctor. This is critical if you're a diabetic, have hypertension, or some of the rare metabolic disorders. Oftentimes, complex medication programs need to be considered first and then reviewed ongoing, even eventually modified. That's because people make so much progress with fasting. They no longer need the same dosing of medications and sometimes can eliminate medications from their program entirely, but all within the review and support of your physician. So you're trying to fast and you feel hungry. Or are you actually hungry? Are you sure you're not just having a craving? I would define true hunger as having a mineral, vitamin, or key nutrient deficiency that would usually take weeks, if not months, to manifest in the human body. You can do 16 to 20 hours without eating. We are all addicted to processed foods and specifically sugary foods, just like a person who feels the need to use a drug, drink alcohol, or smoke when their body doesn't need any of those things. You also feel the need to consume something that you don't actually need. However, alcohol is one of those few drugs that no one should detox on their own from because withdrawal can result in death. I would say when an alcoholic feels the need to drink, it is probably not just a craving. It is the body trying to deal with a physical dependence. They can get seizures and die. So how do we discern between your body having a food craving versus true hunger? Well, first of all, unless you're diabetic and insulin dependent, you likely are not going to need to eat something to raise your sugar in a 16 to 20 hour window. Trust that your body has a mechanism called ketosis to keep you going for likely weeks without food. So we're just trying to get you to 60 to 20 hours a day without eating. You will be fine. But if you still don't trust that, drink some water and then drink some water with electrolytes. If you absolutely can't tolerate the sensation, consider something keto, like coconut oil or olive oil, like a spoonful. Reset and rest and reassess. The more you introduce little snacks outside of your eating window, the more you will confuse, this is key, the more you will confuse your body as to which fuel source to utilize. Am I going ketones? Am I going sugar? That transition between systems is likely what is contributing to your sensation of hunger and distress. You must break through this. Trust that millions of years of evolution are on your side. It's probably a craving and not true hunger.